Staphylococcal hypersensitivity. Symptoms: mild photophobia, mild pain, localized red eye, chronic eyelid crusting, foreign body sensations or dryness, history of recurrent acute episodes, chalazion or stye. Sign: singular or multiple, unilateral or bilateral peripheral corneal stromal infiltrates, with a clear space between the infiltrate and the limbus, and variable staining with fluorescein, minimal anterior chamber inflammation, sectorial conjunctival injections typically. Etiology: infiltrates are believed to be a non-infectious reactions of the host antibodies to bacteria antigens in the setting of staphylococcal blepharitis. Workup: history, current recurrent episodes, contact lens wearer, a risk factor for infection. 2. Slit lamp examination with fluorescein staining and IOP check. If an infection infiltrate is suspected, then corneal scraping for culture and smear should be obtained. Treatment: mild, warm compress, eyelid hygiene, and a fluoroquinolone antibiotic QID and bexistratin ophthalmic ointment QHS. Moderate to severe, treat as described earlier, but at a low dose of topical steroid, prednisolone 0.25% QID, with an antibiotic, fluoroquinolone QID. A combination antibiotic steroid can also be used QID, latemprenol, tobramycin, or dexamethasone tobramycin. Never use steroids without antibiotic coverage. Maintain until the symptoms improve and then slowly taper. If episodes occur despite eyelid hygiene, add systemic tetracycline or doxycycline until the ocular disease is controlled for several months. These conditions have an anti-inflammatory effect on the sebaceous gland in addition to their antimicrobial actions. Topical azithromycin QHS or cyclosporin BID may be helpful in controlling eyelid inflammations. Low-dose antibiotics may have to be maintained indefinitely. Tetracycline and doxycycline are contraindicated in children less than 8 years, pregnant women, and breastfeeding mothers. Follow-up: in 2 to 7 days, depending on the clinical pictures. IOP is monitored while patients are taking topical steroids.